working hard and coming to you live at 1 o'clock every day, as we will be doing every day this week. 1 o'clock, tune in here to get the most accurate, up-to-date information about coronavirus as it pertains to the state of Rhode Island. Today I'm very sad to begin my report with reporting another 10 deaths as a result of coronavirus, bringing us to a total of 73 deaths from coronavirus since we've started this virus together. We have 311 new cases in Rhode Island for a total of 2,976 cases, and we have 197 people in the hospital. I do want to remind everybody that although these numbers are increasing very rapidly, and we're now up to nearly 3,000 cases, it's not alarming, or shouldn't be alarming. It's on account of two things. One, the fact that we know we have widespread community transfer, and we've been predicting this for weeks. But secondly, we've really ramped up our testing. So, we're now testing 4 or 5 times as many people as we were a week and a half ago. So obviously, we're going to be having many more folks who are positive. And that's a good thing insofar as we have a more accurate picture of what's happening in Rhode Island. I want to start this afternoon by talking directly to business owners. I will say that the economic decisions or the economic impacts of the decisions that I have had to make over this past month weigh very heavily on me. I have spent every day for the past 6 years as your governor working hard to get people back to work. And I'm the last person who wants to be making decisions to close businesses and temporarily put people out of work. Having said that, right now, as your leader, I'm faced with no good options. The options that I'm weighing are bad option A or bad option B. And so I am doing my best to follow the best guidance and evidence and science and making decisions that will keep everybody safe and healthy and alive, do the minimal amount of economic damage in the here and now, and then do everything we possibly can to get everybody back to work as soon as possible. So I want you to know I'm not taking these decisions lightly to impose restrictions on our economy, and I have tried hard to keep as many businesses open as possible, helping you to work from home, encouraging small businesses to become more tech-enabled to work from home. And I also want you to know I begin every day, every meeting, asking the question, what do I need to do to get people back to work? What do I need to do to really start turning the switch back on? And as I've said many times, it will not be an on-off switch. It'll be a gradual switch. But it's important to me that you know it is top of mind for me, and it is my goal that Rhode Island will be one of the very first states in the country to begin emerging and getting people back to work. And everything we do is designed to get us there together. In the meantime, the brutal reality of what we're living is that there's tens of thousands of people out of work, laid off, unemployed, struggling to pay rent, struggling to buy food, struggling to keep the doors open for your business. And I hate that, and I'm sorry, and we're going to get you back to work soon. Also, I'm doing everything I can to help you out in the meantime. And I hear from you every day. The federal SBA loan program, also known as Paycheck Protection Program, PPP, is available and taking applications. That's been made available because of the federal stimulus and the CARES Act. It's a program that helps small businesses keep workers on your payroll through the crisis by providing you with forgivable loans. So you can seek a loan, and it'll be forgivable if you keep employees employed. That has been made available due to the very hard work of Senators Rhode and Whitehouse and Congressman Cicilline and Langevin, and I want to again publicly thank them for their advocacy on behalf of Rhode Island. You have to apply through an existing SBA lender. So that's a credit union, a bank, whoever your existing financial relationship is with. Find an SBA lender and file an application. I will be the first to admit this is a good thing, but a far from perfect thing. I know it isn't perfect. I know that because I'm hearing from you saying that you can't get the loan, you don't know how to find an SBA lender, you don't have an existing relationship with an SBA lender or bank or a credit union. So I have been working hard to try to figure out additional resources for small businesses. A few weeks ago, I placed a call to the senior team at Goldman Sachs. Rhode Island has had, over the past 5 years, a very good relationship with Goldman Sachs because they partnered with us to do the 10,000 Small Businesses Initiative, and we have supported over 250 small businesses through that Goldman program. I reached out to them and said, Rhode Island needs help. What else can you provide, and how do I make sure Rhode Island is first in line? And so today I'm very pleased to announce that Goldman Sachs is committing $10 million to a loan program for small businesses in Rhode Island. And I'm very happy to say that we are among the first states to be rolling out that initiative today with Goldman Sachs. The program will operate in partnership between Goldman, Rhode Island Commerce, and the Community Reinvestment Fund. So you might be saying, how do I know if I should apply? If you're a small business or a small nonprofit, if you need access to cash, you're having trouble paying your rent, trouble paying your bills, you're still getting your bills, but yet your revenue is not coming in, and you have been challenged, you can't access the SBA PPP program, I want you to think about applying for this new Goldman Sachs loan fund. Best way to do that is to go online to the Commerce Rhode Island website, which is commerceri.com. commerceri.com. Or you could call 521-HELP, which is our business helpline. But we're really trying to drive all applications through the website, so commerceri.com. So again, these are loans for small businesses and nonprofits who are really strapped for cash flow. For whatever reason, you haven't been able to get the small business PPP loan. Check this out. It's available today. Loans of up to a maximum of $250,000, available immediately, and also largely forgivable, again, if you continue to employ folks. So I hope this helps. It isn't perfect. It's not enough money. I'm going to continue to work to get more to help you. But just know this is something else, help's on the way, and it's going to help us all get through this. I want to take a minute to talk about testing. I announced a week ago or 2 weeks ago that I'm managing the all of government response to coronavirus through 10 teams. I've assembled 10 teams of experts, each managing a particular workflow. And throughout this week, I want to give you updates on where the work is in each of those 10 teams. I'm going to tell you where we are now and where I'd like to get us. So today I want to take a minute to talk about testing. Testing matters so much. I was just on the call with all the governors in the White House talking to experts, health experts, and everyone agrees in order to get people back to work, we have to have a robust, statewide, widely available, accessible, affordable, highly accurate, fast testing scheme. That's what we're trying to get to, so that when we're all back to work, we can, if you think somebody's sick or you've been exposed, you can get tested quickly if you're positive into isolation quickly, and we never again have to shut down the whole economy. So we've been working hard on testing. I want you to know in the past week alone, we have made huge progress. For a reference point, 2 weeks ago, we were doing about 500 tests a day. And at that time, I said I wanted to get to the goal of 1,000 a day. Last week, we averaged 2,068 tests per day, so double where we were the week before and double our goal. 40% of those tests have gone through our first-in-the-nation partnership with CVS, which is rapid. You wait for your test, you'll know the result within 15 minutes. So since we've started this together, we've performed more than 20,000 tests in the state of Rhode Island, and on a per capita basis, as far as we can tell, that puts us number 3 in the country in terms of our capacity to test and how many tests we've performed, behind New York and Louisiana. This is a remarkable accomplishment, only made possible due to the hard work of so many people. So I want to say thank you, and I want Rhode Islanders to know we're among the best in the nation for how many tests we're able to do in a given day per capita. Now, that doesn't mean we're done. It means we've made huge progress, but there's a lot more to do. So let me tell you where we're going next, what we're working on now, and what I hope to be able to make announcements on later this week, in the coming days, maybe early next week. The first thing is mobile testing. We know there are a lot of people in nursing homes, in senior living, in group homes, in other kinds of congregate living settings where they can't get out, so we have to bring the testing to them. So we are working on and trying to make widely available mobile testing, whereby we could go to the nursing home, we could go to a congregate care setting and rapidly do the tests. We're doing some of that now, but we need to move to a place where that is widely available. So that's our focus, and that's what I'd like to come back to you on later this week with an update on. The second thing is more inner-city testing sites. So all over the country, we're learning that there are certain populations, poorer populations, people of color, people in inner cities, folks who don't have a car, people who don't have great access to public transportation. We're just not getting to them enough, and we need to, and we will. And so we're working hard to figure out how to put swabbing sites and testing sites in the community to make it easier for people to walk to in the event that they don't have a car or can't get out. So those are a couple of initiatives that we are working on to try to push our testing process forward. Relatedly, we have to also continue to build up our capacity to isolate people once they've been identified as positive. And again, that's part of the system. We have some facilities now. We've taken over some hotels, but that's another area where we're building capacity, because when when the economy comes back, we need this all to happen quickly: tested, positive, isolate. And so that's where we're moving, and that's what we're working on. A final comment on testing, which relates to today. I'm sure you can see, if you look out your window, we have terrible weather today. Between this afternoon, we are going to experience 65, 70-mile-an-hour winds, 1 to 3 inches of rain. As a result of that, we have had to close today all of our outdoor testing sites. I'm sorry about that. It was necessary. They'll all be reopened again tomorrow, and you should be notified today about, if you had an appointment today, you're going to get a time tomorrow. You'll get a time tomorrow if you were supposed to be tested today. I will give a big thank you to the many of you who worked all day yesterday on Easter Sunday. We had to make this decision yesterday so we could batten down the hatches and protect. We have, millions of dollars of equipment in these outdoor tents. So thank you all for securing the equipment and securing the tents. And to all of Rhode Island, we'll be back up and running tomorrow. Unemployment. As I mentioned earlier, there are so many people unemployed, and we want to do everything we can to get an unemployment check into your hand as fast as possible. It's also very confusing because the federal government has created new kinds of unemployment benefits as a result of the coronavirus. So I'd like to just take a second to quickly go through again who is eligible for unemployment insurance type benefits and how you claim those benefits. I will begin by saying begging for your patience. In the past few weeks, we have had 144,000 Rhode Islanders file for unemployment insurance. 144,000. If you're one of the lucky ones that's still working, just take a minute to reflect on how many of your fellow Rhode Islanders are out of work right now, and on top of everything, they're struggling because they can barely pay the bills. And if you're one of the 144,000, I want you to know we're working every day, all day, to get you your checks and get this processed. Having said that, this is totally overwhelming, so I'm going to beg you for your patience and know that it could take us between 7 and 14 days to get you your check from the time that you file your application. I want you all to go online to file your application, and I want you to take extra special care to make sure that every piece of information that you put into your application is accurate, because if it's not accurate, that's what slows down the checks, or that's what slows down the process and slows down the check getting to you. If it's all accurate, we can pretty quickly file it and get the check out to you. If we have to manually check the information, make sure it's right, call you to verify, it just slows down the process. Okay, so there are 3 tracks. There are 3 ways that you can receive unemployment insurance type benefits. The first one is just standard unemployment insurance. This is something we're all familiar with. It's if you've been laid off from a job, a part-time job or a full-time job, go to the DLT website and file for unemployment insurance. And as I say, hopefully your check will get to you within a week, maybe 2 weeks. There's also going to be an additional $600 a week benefit till the end of July for unemployment insurance, added on to what you would normally receive. That's part of the coronavirus stimulus initiative. The second unemployment insurance type benefit is something the federal government created to respond to the crisis, called the Pandemic Unemployment Assistance Program. How do you get that? You can get that in one of 2 ways. One way is pretty straightforward. If you are out of work, laid off because of the coronavirus crisis, you can go ahead and file for that benefit. So that's for people who aren't usually available for unemployment insurance: hairdressers, independent contractors, gig economy workers, Uber drivers, self-employed people, small business owners, all those categories of folks that typically can't get unemployment insurance, barbers. Go to the DLT website and file for what's called PUA. You're eligible, we'll get you your check quickly, and you'll also get an additional $600 weekly until the end of July. So I was with a person the other day who said that his father was a barber and he can't file for unemployment insurance and he's really struggling. So I said, no, if even he's a barber, go DLT website, file for the PUA. He is now eligible. The third category of people who's eligible for unemployment insurance are those people who haven't been laid off, but who have been so severely affected by the coronavirus that the federal government says they are eligible also for this PUA benefit. Now, I want to caution that this is the hardest benefit to receive and will take the longest for you to receive your check. Why is that? Because these are for people who, unemployment insurance is for people who've been laid off. That's the guidance I want to give you. Federal government has said there are some people, if their doctor tells them you're too sick and the risk of being exposed to coronavirus is too high, you can't work, or if they themselves have been exposed to coronavirus, they can't work, then they also are eligible for this PUA benefit. The process to verify whether you are eligible for this benefit is arduous, and we're going to make you jump through hoops because we have to in order to comply with the federal government's guidelines, and also, candidly, to make sure there's no fraud. As of today, if you go on the DLT website, they've done a good job of clearly marking these 3 different buckets. Make sure you file in the right bucket, because you don't want to put yourself in that last bucket, because that could take up to a month to get the check. I want to say a few things. Being afraid to go to work because you're afraid you might get coronavirus is not a reason to be able to collect unemployment insurance. We're all afraid to go to work, but those of us whose businesses are open, we're the essential workers that have to continue to go to work. So I know it's difficult. I'm asking you to be courageous, to get up, to suit up, and to go to work, because we need you. If you can't work because you fall into that narrow category of people so affected by the virus that your doctor says you can't, or because your business closed, or because you've been laid off, then there's benefits there for you, and we're going to do our best to get it to you quickly. As for employers, I'm asking you all to continue to work hard, even harder, to make sure that your employees who have to work are well protected. Hand sanitizer. Do not make anyone work if they are sick. No one, nowhere, no how should be going to work if they're sick at all, period. I don't care how essential you think you are. If you're sick, you stay home until you have no symptoms. Employers, I'm asking you, if you can, do a physical check of employees before they come in to work to make sure they're not sick. Do a temperature check if you can. Make sure everybody is wearing a face cloth covering while they're in the office, and make sure there's ample opportunity for people to wash their hands, and give your employees an opportunity to work at an appropriate social distance from their colleagues. But within these parameters, if you're healthy and able to, we need you to go to work. And believe me, I know it's tough. Finally, I want to make a mention about schools. Today marks the start of our 5th week of distance learning in Rhode Island, and so I'd like to pause and thank everybody who's worked so hard to make that possible. Educators, principals, superintendents, parents, and the kids themselves. You guys are doing great, by the way. You're being creative. As far as I can tell, you're reading. Tens of thousands of you are reading every day in the month of April. Overall, it's not perfect, but it's pretty good. It's better than pretty good. So thank you for all of your great effort. Like everything in this crisis, the most vulnerable are having the greatest challenges. And with distance learning, those are the kids and parents and households who don't have Wi-Fi or don't have a computer. Now, a couple of weeks ago, we announced some really fantastic partnerships that have enabled us to provide more students with access to Wi-Fi. And through those partnerships, we've made tremendous strides, really tremendous. The vast majority of students, like 90% plus, do have access to Wi-Fi through the different means that we've made available. But still, not everyone does have access, and we need to do more. I said in the beginning, I'm committed to making sure every single kid has a chance to learn through distance learning. That doesn't mean 90%, that doesn't mean most kids, it doesn't even mean 98%. And if you're a kid out there who's listening to me and you're struggling, maybe there's you and your bunch of your brothers and sisters in one house and there's not quite enough internet for you to make, to get your schoolwork done, I'm talking to you. I want you to know we're on it. We're doing more, and we're going to do better, and we're going to make sure the internet gets better in your house so you can have the same chances as every other student in Rhode Island. So today, I'm proud to announce that the Rhode Island Foundation has partnered with Rhode to close the gaps, to close that last mile. The Foundation's committed over $100,000 to provide computers and Wi-Fi hotspots to those children that we know are still in need. So as I've often said, as I say every time when we roll out something philanthropically, thank you to the Rhode Island Foundation, thank you to Rhode, and if you are one of the lucky ones and you're able to make a donation to help somebody out, please go to the Rhode Island Foundation website. They have a special section, RI Education, and please donate. Any amount helps, and every one of these kids wants to learn, and it's on us to make sure they have the tools to be able to learn. I'm sure many of you are wondering when I will make announcements about the rest of the school year, and the answer is later this week. I'm talking to the superintendents tomorrow. I'm going through all the data to see how well students are doing, make sure we can reach everybody with Wi-Fi, and later this week I'll make an announcement about the rest of the school year.